Hello, I hope everybody had a great weekend and enjoyed the nice weather. We are back with another live. Tonight we are going to be talking about one of my favorite topics, and I have a lovely model here, so you don't just have to look at me. We have Maddie tonight who's going to be helping us out. My name is Dr. Heather Moore. I'm owner of Total Performance Physical Therapy. Tonight we're going to go over what is IT band tendinitis. It is very, very prevalent right now as people are getting outside more, and a lot of times it's a byproduct of, I bring this up because I saw somebody tonight with Achilles tendinitis, but now they've ignored it so long now it's become IT band tendinitis and things like that. So it's a very prevalent condition in the legs, and a lot of people have issues with the IT band, so we're going to talk about what it is, what you do once you get it, once you have it, do you have it, and where we go from there. So, well, first of all, what is the IT band? It's the iliotibial band. So, I'm going to show you on Maddie here. So, it basically runs from here, top of your hip, all the way down to the knee. Alright? So, it's huge. It's this big. Alright? A lot of people, when they're talking about the IT band, really only focus on here. Alright, it is extremely important that you concentrate, especially when you're working on it, some of the techniques we're going to show you later, that you focus on up at the hip and all the way down at the knee. If you ignore those two areas, it is not going to get better. So a lot of people just like to roll kind of the belly of the tendon, and that's not okay. You've got to get the whole IT band involved in order to be able to solve the problem. And that's what makes treating the IT band so difficult, and part of the reason it flares up so much is because every time you bend your knee, no matter how slightly, this IT band right here is rubbing, all right? So as you bend your knee and then you straighten it, it's kind of being played like a little violin. So you get a lot of tendinitis. Cyclists, runners, anybody who's doing just this little bit of motion constantly is running the risk of that IT band tendinitis. And as you develop knots, or as that IT band gets tight and it starts to shorten up, it starts to really be irritated as that knee is bending and straightening. So you wind up with that irritation, you wind up with that tendinitis. But what the problem is most of the time IT band tendinitis is not a standalone diagnosis, meaning we very rarely see someone come in with only IT band tendinitis. You've got to figure out the cause of that IT band tendinitis, and this is where it gets a little bit tricky. And if you just treat the IT band and you ignore everything else, you're not going to get a good result because you don't know why the IT was inflamed to begin with. Yes, the IT gets inflamed because of the constant bending and straightening of the knee, which is what a lot of people will blame it on, then just kind of resolve that tendinitis and think they're done. But if you don't understand the root cause and why that tendon was inflamed to begin with, then you're going to have a problem. So a couple of factors on why that tendon can become inflamed is footwear. So if you're flat-footed, you don't wear proper footwear, flip-flops, barefoot, what happens is when your foot hits the ground and you strike it, your knee actually will collapse in. Way gross demonstration of what that looks like, but if you slow yourself down, you'll see your knee collapse in a little bit. That puts pressure on the IT band. So every step, every run, every cycle, you are winding up putting up a lot of pressure on that IT band as your knee collapses in. Your IT band is going to work to pull your leg out. So that's just one of the many things that could cause it. If you are limping for any reason, so if you have an Achilles tendinitis, a calf strain, something along those lines, and you're winding up limping, you're not going to put as much pressure on the leg, you're going to collapse inward. Again, that IT band is going to work harder to pull that leg out. So that could also be a cause. You could have a weak hip complex. You could have a weak abdominal complex that causes that hip to drop. As that hip drops, that knee is going to go in. That also can cause that IT band tendinitis. You can have weak hamstrings that don't balance out the quadriceps. The IT band has to work hard to make up for the deficiencies between the front of your leg and the back of your leg. With that, the IT band has to work harder. There comes that IT band tendinitis. So there's a myriad of things that can cause IT band tendinitis, and it's really important that you get to the root. It could be all of those things. So don't just think because you've diagnosed yourself with a weak glute that that's it. But it's really important to look at running form. It's really important to look at cycling form. If those are your sports and that's something that you do repeatedly, it's really important that you look at your footwear. It's really important that you look at your strength. It is not just, okay, I've just got to get the knots out. I've just got to do a couple of exercises to make sure this is nice and loose, and then it will be good. So be aware that finding the cause of the tendinitis, and any tendinitis, biceps tendinitis, elbow tendinitis, wrist tendinitis, why is that tendon being overworked? It doesn't just happen. So whenever you're talking about a tendinitis, you really got to understand what the cause is and find the cause. So that's the first thing. So then what do you do once you identify that you have IT band tendinitis? So I'm going to show you a couple things tonight just to treat the IT band. This is regardless of what the cause of it is. It's going to address just that IT band tendinitis. Again, if all you do is address the IT band tendinitis, if you don't address any weakness, or you don't address any, or you don't find the root cause of why you have it, you're going to fail, and it's going to be a repeated issue for you. So make sure that you find that cause and don't just do the couple of exercises that we're going to show you tonight to loosen it up. I want to cover the stretch that is all over the internet. It is the IT band stretch. You're going to cross your legs something like this, and then you're going to jut your hip out. Something like this. I don't know. It's not the best stretch. It is not highly recommended. If your knee hurts when you do it, like mine just did because I don't do it, then stop. It's really hard to stretch the IT band because it is so fibrous. We usually recommend rolling it, so just be careful. Yes, I will show that. There will be videos on that you will find on our channel on how you can stretch the IT band, because there are some people that get significant release from that stretch. A lot of times it's more in the upper hip. A lot of times it can be up into all the way into the abdominals where they feel that release. So I'm not saying it's horrible, don't do it. I usually don't recommend it, and a lot of people will wind up hurting themselves worse or just quitting altogether because like, I can't, that stretch just hurts, I can't get it right. Don't get frustrated, I don't do it, I just demonstrated it very poorly here because it really bothers my knee to do it, and I don't have IT band tendinitis, it just bothers my knee. So don't get frustrated if you Google IT band stretches. That's the one that's going to pop up, and I get a lot of people, we treat this a lot, so we get a lot of people in here and they're like, I can't get that stretch, I don't want to do it. Don't worry about it. What we're going to show you here tonight is a couple things that you can do at home. So one of the things that we're going to show you right now is Maddie is going to demonstrate our foam roller. So if you follow us, you know we are big into foam rolling. We have a lot of things on foam rolling. Why? It's something you can do at home. It's something that even once you're done with therapy or you've gotten your treatment, you need to continue. Your body isn't just going to work perfectly forever. So we really show you and demonstrate a lot of foam rolling techniques because this is one thing you're able to. It's a very inexpensive piece of equipment that you can just put in a corner and you should be using every day. And you basically can roll the whole body. We're not going to go through that tonight, but we're going to go through some things that are going to help loosen up that hip and that IT band. But it's really important to have that foam roller. Now we're going to demonstrate it tonight with spikes. You don't have to necessarily have a spike one. The IT band tendon, if you've never rolled it out before, can be extremely painful on something like this. So you want to understand that if you are doing this for the first time, you might want a flat roller. The IT band is a very, very, very tender spot to roll. So it may take you some time to work up to having spikes being driven into your leg. But that's okay if you have a flat one, and that's where you start. Maddie's a pro, so she's going to demonstrate on the spike. All right, so she's going to get it down to the first position, which is generally where you're going to start rolling out your IT band. So you're going to start on your side. Now I'm going to show you two different positions. Maddie's going to show you the easiest one first. So here she is on her side. Now, to make this easier, you want to push up on your arms and you want to push up on this leg so you have the least amount of weight coming down on the bottom leg. Why? Because that's where your IT band is. So if you really are struggling with a lot of pain as you roll, push up on your arms and push up on this leg, lifting your leg off the roller so you only have a little bit of weight. Now as you get more comfortable and as that loosens up, you can then put more weight down. But in the beginning, you may have to have most of your weight on your hands and on that top leg just to avoid the severe pain. This is going to hurt if it's your first time. So don't shy away, don't put the roller back in the cabinet because it hurts. It's going to hurt. If it does hurt though, you really should consult a medical professional. We do offer free consultations. All you have to do is call our office at 215-997-9898 and we'd be happy to get you in. But make sure that you are able to continue rolling, because don't just give up because it hurts. So Matt is going to show you how to roll it. So you basically are going to start walking. You're going to walk your hands, you're going to walk your legs kind of upwards, because you want to make sure you get that whole IT band. You're going to go from the hip all the way down to the knee. Again, don't just do this middle part. Even though it's probably very painful, you want to make sure you get the top of the IT all the way down until it crosses the knee. There's a nasty rumor out there that you shouldn't go across your joints. Unless there's an open wound, a scar, or cancer site, honestly, go across your joints. So you're going to roll up and back. You want to do this for about 2 minutes if you can. If it's too painful, just start with 30 seconds. If you find a tender spot and you're able to stay on that spot just for a few seconds to break it up a little bit, go for it. Now Maddie's going to go into the more advanced IT band rolling. So on this, you're going to stack your legs. All right, don't try this if you haven't ever rolled your IT band. It could be very painful, but this is the most advanced way. And again, you're going to roll the same exact way. You're going to roll all the way from the hip all the way down to your knee. Now, you're going to roll across the floor. Like Maddie's moving the roller in her hands because she's trying to stay in the shot of the camera. If you do this right, you're going to wind up nowhere near where you started. So don't be alarmed if I get that question all the time. I'm moving all over the place. You should. We shoot these videos in this screen, that's it. So we have to make adjustments to the roller, we have to make adjustments to our body so we stay on camera. But when you're doing this, you're going to roll up and down. Walk your hands up, walk your hands down. But make sure you get that entire muscle from the knee all the way up to the hip. The second exercise you want to do is you want to focus on the hip, the piriformis. So we're going to go into the figure 4. This is important. It's not necessarily on the IT band, but it's going to address that hip area, which is always very tight on people, especially with people with IT band tendinitis. So you're going to first cross that ankle over the knee, and if you can't do that, then we have an issue to begin with. But this is where you want to start, is this figure 4 position. You're sitting on the roller, your ankle is crossed over your knee. You can just start by rolling back and forth. You want to roll from the top, right where your low back is, all the way down to the bottom of your glutes to get that whole area. You roll this a couple times. You may or may not feel any tender spots. If you do, again, you can stop. Then you want to shift your weight over towards the leg that's crossed. All right, so Maddie's going to lean a little bit. This is going to get more of that outer IT band area. And then she's going to switch and go to the other side and kind of rotate towards the other side. So you want to make sure you're doing both sides because unfortunately everything connects. But you want to make sure that you're loosening up those hips because if the hips are tight, they're not going to allow that IT band to loosen up. This also can be turned into a stretch, just like Maddie's demonstrating. Instead of doing it on a foam roller, you can just sit at your desk, cross your foot over your ankle, just like so, and then just lean forward. So that's a really easy way to also loosen up a little bit, just to turn that figure 4 roll into a figure 4 stretch to loosen up those hips. Whatever the case may be, again, when you're dealing with IT band tendinitis, knowing the root cause is extremely important. If you can't find the root cause, you're not going to be able to solve the IT band tendinitis. It's going to reoccur time after time. If you know someone suffering with knee pain, IT band tendinitis, hip pain, and they want a free consultation, all they have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.